Hello, dear friends. My name is Sofya Dorinskaya. I am a doctor and the head of the Center for Medical Information. At our center, we help to eliminate nutrient deficiencies. Some of you may already know this, but for those who don't, let me explain. We are building a library of scientific and medical literature dedicated to nutrient deficiencies. Furthermore, it is important to note that this literature actually traces its historical origins back to the period before medicine was officially integrated with the field of pharmacy, and so to speak began to fall under the significant corporate influence of Big Pharma. In other words, these are studies by doctors who genuinely wanted to find the answer to the question why. Why do people get sick? What is happening? How can we help people safely and effectively? And so on. Undoubtedly, a huge number of studies were devoted to nutrients, vitamins, and so on. And it was within these various medical publications that I eventually discovered a fascinating concept, originally introduced by professional doctors, the idea of the true disease. An amazing concept. So what is a true disease? It is a disease that goes away when it is treated. It seems simple enough. Simple, but not quite. We all get sick. Well, I don't know. Most people get sick, right? And a lot of people go to doctors. And I think you are definitely familiar with situations where a person has been diagnosed with a disease, is prescribed medication, keeps going for treatment again and again, but the disease doesn't go away. The concept of a genuine underlying disease is a term used for a specific condition where a course of medical treatment has been carefully prescribed for this illness, and then it completely disappears. Do you understand? And the fundamental task that was set before doctors back in those days was to find the true hidden disease. Not merely the symptoms that are visible on the surface, and not just what is immediately obvious, but the actual underlying condition, the successful resolution of which leads directly to the person's full and absolute restoration of their health. That is what a true disease is. In this regard, I would like to share several examples of exactly how certain nutrient deficiencies can affect a person's health and well-being. Let me read to you now what changes occur. Deficiencies. In the ovaries? So the ovaries showed a decline in evolutionary function and the testes in their sperm-producing function. Nowadays, a person can quite well be treated for infertility, both male and female. They undergo treatment, but nothing works. And they keep going for years, keep going, something is happening, but nothing works out. Why? Because the true disease has not been identified. What changes occur in the pancreas? Atrophy of glandular cells, general dysfunction of the thyroid pancreas, a sharp decrease in the islets of Langerhans. We already discussed this in the previous video. The islets of Langerhans and their cells have a vast range and a huge influence on the human body, including on insulin production. A person keeps treating their diabetes, but nothing helps because they are not treating the real disease. The skin. Hyperkeratosis. Now this is called ichthyosis. This is called various types of dermatitis, right? They keep treating neurodermatitis, and all of this is considered chronic and never gets cured because this treatment is not for the real disease. The progressive destruction and breakdown of neuroglial cells is a significant sign, it is sort of a cellular indicator, of neurodegenerative diseases such as Alzheimer's disease, for example, and multiple sclerosis. Again, they keep treating, but none of these conditions are ever truly cured simply because they are not treating the real underlying disease. Now, the adrenal glands are actually quite fascinating to study. Atrophic changes have severely affected the medulla of the adrenal glands. Yes, that means leading up to its complete and total disappearance, the medulla, which is the inner layer of the adrenal glands. These are complex endocrine and hormonal disorders like Cushing's disease or now what they commonly call adrenal fatigue syndrome. They keep treating, and treating it, and there is even a separate medical diagnosis for it. But it doesn't help much because they are not treating the actual underlying disease, and so on. Consider the stomach. There are significant atrophic changes occurring within the mucous membrane. Atrophy. Atrophy of the villi located in the lining of the small intestine. Atrophic changes in the mucous membrane, diseases of the gastrointestinal tract. They keep treating, yet it does no good because they're not treating the real disease. The kidneys, fatty degeneration of the kidneys, general shrinkage, loss of function up to adrenal insufficiency, a chronic condition. They keep treating. There are separate diagnoses. They can't cure it because they're not treating the real disease. What I just quoted to you, I simply told you about studies on certain nutrient deficiencies. These are autopsy data from people who died from these deficiencies, confirmed by autopsy findings. That's why nutrient deficiencies absolutely need to be thoroughly identified and properly addressed. If you don't take into account a person's specific nutrient deficiencies, then it's absolutely, well, you can say with an absolute and nearly 100% level of certainty, that it's virtually impossible to cure the disease. This is because we're not looking at the true fundamental nature of the actual illness, and we're not looking at what serves as the primary foundation that underlies the development of this complex pathological condition. And addressing and correcting essential nutrient deficiencies, that is simply fundamental feeding. It is not medical treatment, it is just basic feeding, right? Therefore, issues of nutrition, issues of correcting deficiencies in parts of nutrition, because nutrient deficiencies, diseases, they are called specific nutritional diseases. They occur according to specific laws. They develop according to specific laws. And if you know how to intervene in this, if you know how to change it while keeping in mind that if a secondary disease already exists, that is one that has already occurred as a result, then it must be treated separately by a doctor. This is by no means a substitute. So here it's also important to understand how this synthesis takes place. But only in this case can we end up with a healthy person whose health has been restored. Be sure to take into account what I mentioned in the previous video about the differences in the course of processes, about the difference between the healing process and the recovery process. This also needs to be considered. So my friends, if you need this kind of help, please come. We will be happy to help you. Thank you for your attention. All the best.